Okay. Good morning, everyone, and welcome to my presentations. I'm Jiratorn Sutawong from HTAB. Today, I will present a rapid assessment of oximeter for screening for CCHD in newborn in Thailand. Let me start by giving you some background information. We all know that parents wish the baby a healthy birth, but some babies are unlucky. They were born with a congenital abnormality and die shortly thereafter. 1/3 of cause of death in infant is a congenital heart defect. 1/4 of infants with the disease have a high severity. Most of them die before being diagnosed. The disease is called critical congenital heart defect. From now on, we call the disease CCHD. Oh, sorry. So what is CCHD and why it's so severe? CCHD is a type of heart defect and that lead to low level oxygen in newborn. It cannot be detected during pregnancy. Moreover, this baby are born with healthy at birth. If the baby receive a physical exam alone, they may go home with a latent risk of death. Currently, the cost of treating with the disease is about 70,000 baht per people per year, or around $2,000. The significance of this is that we cannot make an early detection of CCHD. Nowadays, medical technology has invented so far. We can screen the disease 24 hours after birth with a oximeter by nurse and at the maternity unit. It is timely care that may prevent disability or death early in life. Okay. In Thailand, this study was done in the form of HALA study in 2012 by Child Health Institute, and as byproduct of the study, only one of the 13 health districts across the country was encouraged to reimburse for CCHD screening. To achieve the reimbursement and feasibility of CCHD screening service across the country, so we did a rapid assessment study as information for the decision making for the health economic working group. So we raised 4 research questions: CCHD screening with a oximeter. Is it safe, effective, and cost effective? What is the critical practice guideline for screening? Is Thailand feasible to provide screening service? And finally, how much does the health fund need to pay for this screening package during the next 5 years? From now on the presentation format, I will be a method presentation followed by the results of each part according to the research questions. In the terms of safety, effectiveness, and cost effectiveness method, we do a rapid literature reviews in both local and international articles by scoping with PICO as follows. And we search through electronic database and use the terminology to search for eligible articles in English and Thai public within 5 years. In our literature review, found 14 articles with a different study type. Result of the CCHD screening with a oximeter was safe and effective, was with an accuracy for more than 82%, sensitivity in the range of 50 to 98%, and specificity in the range of 84 to 100%. And of course, this cost effectiveness across according to each country will have to pay criteria, which we found in 4 studies conducted in UK, China, and Canada. Regarding the critical practice guideline method, we reviewed the CPG national and international by collaborating with the Royal College of Pediatricians of Thailand. And CPG in Thailand already exists, followed by the American Academy of Pediatrics guideline. From the research question, is Thailand feasible to provide screening service? We designed two feasibility surveys. First is a survey commonly distributed in Thailand. And the questionnaire was divided into three sections as a blue boxes. Second, survey maternity hospital by sampling 10% from a previous pilot hospital. The questionnaire was divided into 7 sections as a green box. All survey we done online platform. And for more detail, you can scan QR code. Yeah. Result the feasibility survey from 43 hospital with a different level of hospital from the first level to advanced level hospital show that 97% from of sample hospital were ready to give CCHD screening with oximeter. As you see in the picture on the left side, the distributions of hospital in Thailand that are ready to serve. And from the survey of 3 companies we received, it was found that distribution and service cover the entire country. True. Interestingly, the survey also found that 98% of hospitals thought referral was critical and needs more support for screening equipment, training for healthcare professionals to prepare the screening, and it also support referral for diagnosis and treatment after screening. Finally, I will go on to talk about BIA. To estimate the budget of using the pulse meters for screening CCHD in every newborn under the universal coverage scheme over the 5-year periods from the public healthcare player. Look at the parameter table. You can see that the numbers of infants used in the calculation trend to decline every year, while cost assumption of screening equipment and cost of diagnosis and treatment remain stable for 5 years. For the budget impact calculation in the study, we propose a free for service reimbursement. It can be divided into 3 options as follows. Option 1 is a reimbursement rate calculation that covers the cost of a per path alone, and option 2, the cost that cover the cost of per path and pulsimeter machine. Option 3 is a lump sum reimbursement rate calculated based on the numbers of babies screened at a flat rate of 30 baht per infant. And you will see that the incremental cost of pulsimeter screening in each option for a total 5 years is 9.8 million baht to 30.4 million baht. In addition of screening of CCHD with the pulsimeter, CCHD can be detected earlier, and there is a chance to save 450 additional babies in the 5 years. Okay, and therefore the study concluded that CCHD screening with a pulsimeter effective and cost effective. Existing approach, feasible and affordable BIA. And we have recommendation that pulsimeter screening of CCHD in newborn should be a benefit of the universal coverage scheme under the condition that screening indication should be adhered to CPG of the Pediatric Association. Screening training should be provided to healthcare professional, and a comprehensive referral system should be considered. And the next step, we will present the study result to the Health Economic Working Group to contribute UCBP. A strain elimination of the study with a relative limited study period. This makes survey data available only in the subunit hospital under the pilot program. The parameter configuration section and the results of BIA hourly forecast and can be adjusted for a different scenario, and current estimates focus only on the universal coverage scheme. Okay, thank you.
Thank you very much. Thanks very much, Jiratorn. So we will let the commentators do the question and answer now, please.
Okay, thank you, Jiratorn Sutawong, for the presentation, and congratulations for your work on this rapid assessment of pulse oximeter for screening of congenital heart disease in newborns in Thailand. So I have a few questions for you. One is that pulse oximeter is not routinely done for newborn one in Thailand, and the issue in terms of congenital heart disease, is it because it's not diagnosed, or there is issue in terms of referral, waiting time to see the expert? Two, and then the comparison of pulse oximeter is what we compare with in terms of its accuracy just now. Okay, that's all for me for now.
Thank you for your question. For the comparison of the study, we compare between we screen with a physical exam alone and compare with a physical exam alone plus pulse oximeter screening. Yes. And for the first question, sorry, I can't understand.
The pulse, checking the oxygen level, checking the pulse oximeter, is it not routinely done for newborn?
No, in Thailand.
Oh, it's not routinely done.
Yeah.
The other thing is that with your findings, how do you want to make sure that it is being practiced?
The last 5 years in Thailand from a Predict Child Health Institute, there has started a pilot study in Thailand for 5 years, and that at that time, nowadays Thailand have 800 hospital that have maternity unit. That's is basically in every maternity unit should have a pulse oximeter for newborn, and at that pilot study, they are done in the 400 hospital that have maternity. It means around 50% of maternity hospital in Thailand already have equipment and they can do it. Is my issue is that it's about reimbursement, how to reimbursement. I will is reason why I propose a free for service. Yeah, thank you.
Good morning. Okay, thank you. Thank you for your very interesting presentation. This topic is very important because this day Thailand has very low fertility rate and we have declining number of newborns. So to save the life of newborns is can benefit the society. Okay. In your research question, one of the question you said that you would like to explore about the safety of using this the power of semester. But in the result, you didn't discuss much about the safety of using this PO. So I would like to hear more about this. And in terms of the cost, you show the cost per machine and the labor cost or the cost of the doctor. In the near future, and we expect that the technology cost is likely to be cheaper, particularly on this machine. But for the labor cost is on the opposite side. How would this affect your calculation or the result or your discussion? Yeah, I have these two questions. Thank you.
Yeah. For the labor cost, I have survey who have to be the screen is a nurse in maternity ward, they use around 15 minutes for screen one baby. Yeah, it's hard to find out that how to pay for their time. Yeah, it's a is the reason why I propose a free for service is a lump sum reimbursement rate. Yeah, and for the cost of machine, in Thai hospital, they're separate from if in the future pulse oximeter screening can be a benefit package. In the past of budget of machine is I want to say that not included in this. It's a capital cost, something like that. Okay, and yeah, and in the future maybe learn more and develop about payment. Yeah. Sorry, I'm not sure that I answered the questions.
One of your research question is when you ask, is it safe to use this machine? And because I'm not in this field, so I'd like to know this. Like, is it safe to use this with a newborn because it can save life? How safe is it?
From the pilot study in Thailand, in incident rate of the CCHD nowadays is a 2 in 1,000 live birth. If we screen with a pulse oximeter plus physical exam, we can find a true positive rate 1 in 1,000 live birth. Yeah, but if nowadays we do a physical exam alone, we will find true positive for CCHD in a 0.5 in 1,000 live birth. Yeah, we save around 450 additional baby for 1 year.
Dr. Warawan, was that the question that you wanted answered? You are actually asking about the safety of the device. So it's not so much the yield, but is it safe to use this device on children, on babies? Are there any side effects from using it?
Sorry, I don't understand your question about the machine.
How do you judge the safety of pulse oximetry?
From sensitivity and
Safety. Whether there's any harmful effect to the newborn if you use this pulse oximeter, right? That's what you want to know.
Surely, the equipment is not harm. It's just a clip in the baby new. This is not it's not involved in the body. Yeah.
It's not invasive. Right?
It's not an invasive technique.
Invasive, yes. Yeah, invasive, yeah.
Basically, I think what happens is that they clip something to the finger, and then there's it shines a bright light, and then it is detected in the finger, so it doesn't actually hurt the baby.
Do you look into the organizational aspects? Maybe if you introduce this screening, you will get more referral to the peds cardiology, for example, to the peds cardiologist. Do you look into that matters, and do you factor in your calculation?
Sorry. I will learn more and answer you back to your answers. Thank you very much.
Well, and in any case, I think we've got signals from behind that the time is up. So thank you very much for that. I would just want to pass just one comment, which is that it's an interesting study that you've done. And I noticed that you did a rapid review of the literature looking at safety, effectiveness. But it seems to me that this is a case of what we were talking about this morning about real world evidence, because you already have a very big pilot study in Thailand, encompassing quite a large number of patients in hospitals. I would have thought it's better to look at, in addition to the evidence from the literature, probably look for effectiveness from the hospitals itself, because that will tell you in practice in Thailand what is the yield actually like, rather than depending on estimates of accuracy from the literature. Okay, so thanks very much for that.